Hello, everyone, and welcome to today's webinar, Leveraging IoT for Medical Monitoring, presented by Aeris and WisePill. I'm Joe Keenan, contributing editor to Fierce Markets, and I'll be moderating this webinar. Our speakers today are Lloyd Marshall, CEO, WisePill Technologies, and Syed Z. Hosain, Chief Technical Officer and Founder at Aeris. You can read their full bios on the right side of your window. Before we begin, I'd like to go over a few technical notes. If you'd like to download the slide deck, please click the Resources List button at the bottom of your screen where you will find additional information. The webcast is being streamed through your computer, so there is no dial-in number. For the best audio quality, please make sure your volume is up. You can find additional answers to some common technical issues located in the Help button at the bottom of your screen. This webinar is being recorded and will be available on demand within 24 hours after the event. We will follow the presentation with a Q&A session. Please submit your questions using the Q&A button on the left side of your screen, and you can do that throughout the presentation. Today's agenda is Introduction, Market Drivers, Challenges, Opportunities, Aeris IoT Connectivity, Current State of Play, WisePill Improves Medical Adherence, and Conclusions and Q&A. Before we kick it off, we have a quick poll for you, which is, what are your IoT plans? The answers are no plans, just exploring options, currently planning deployment, currently deployed, building next-gen solutions. You have about 20 to 30 seconds. Just go ahead and click on one of those buttons and we'll give you a little bit of time before we move on. That ought to do it. Okay, I think we're ready to begin. Z, please go ahead.
Okay. Very interesting. Okay, well, not surprisingly, in some of the early webinars that we do that are informational webinars, seeing the fact that there's about 74% of people just saying there are no plans yet, just exploring options, seems like a logical answer to that question, to that poll question. It was about 4.3%. They're currently planning deployment, and about the same were currently deployed, and 17% are building their next-gen solution. Okay, that seems about right. The fact that people are just exploring at this point is a good place for us to do a little bit of a informational webinar perhaps over here. Sounds good. Lloyd, do you have any comments?
No, that sounds tremendous. Welcome, everyone. I'm excited about sharing some of what we've been doing in this space with you.
Very good. Thank you. Well, let's dive right in, if you don't mind. Joe, I'm just going to jump right in and proceed over here.
Please do.
Let me give you thank you very much. Let me give you a little bit of information about who Aeris is, who we are, what we do. We are a US-based company. Our headquarters are in Silicon Valley in San Jose, although we have operations that are available pretty much worldwide, global services in more than 190 countries. Our SIMs are usable just about everywhere that you're likely to deploy an IoT application of some sort. We have operations in Chicago, in the UK, India, and Japan. Very large facility both in Chicago and in India. And as you can see from the logos on the slides there, we have 24/7 call centers and support centers sprinkled in various regions around the world to support our customers. And we have network operating centers here in San Jose, in Vegas, London, and Delhi. And the idea behind that is, again, geographical diversity as well as redundancy for high availability for the kinds of applications that our customers are deploying. So that's pretty much all I really want to say about Aeris. And if anyone has any questions, we have a lot of information available on our website. Please feel free to go there and take a look at what we're up to. So let me dive right into what IoT is all about and where sort of medical fits in there. As you will see from this informational slide from McKinsey, that IoT is having an impact in just about every market that you can think of. It's enormous, and the growth is absolutely staggeringly enormous, in the trillions of dollars per year. One of the largest areas is indeed healthcare and fitness. As you can see in the bottom left a little bit, is marked as health and fitness, somewhere between $170 billion to $1.6 trillion by 2025. That's a large number. And there's a wide range here because there's a good expectation that applications that are deployed will be in a variety of different sectors. And as yet, the total impact is still being discussed and spoken about. And at some point down the road, you will see these numbers get a little bit firmer when we get closer to the 2025 range. And again, the point of this slide is just to emphasize that IoT has an impact just about everywhere, and healthcare and health and fitness products that are being deployed using IoT services and IoT capability of the kinds that we do, among others, that the kinds of services that we provide are going to be an enormous market in the not too distant future. I'd like to mention some of the drivers of what is called the telehealth and sometimes called the mobile healthcare market. There are a number of significant factors that are driving the changes that are occurring in general across the board. And this is not just a U.S.-based discussion. It's around the globe, frankly. The most salient of which is the fact that the population is aging. And the United Nations made a comment that the aging is one of the most salient social, economic, and demographic phenomena of our times. As people get older, as you see the age of the general population increase, you're seeing a need for more healthcare, more medical care, and the need for that healthcare continues to grow quite significantly. The other comment, which I think is very important, is that patients are becoming comfortable with using technology. In the past, one might have questioned the usage of high-tech IoT-type devices in healthcare. There's becoming a growing acceptance of such devices in many countries, starting with sort of perhaps non-mission critical healthcare applications, but slowly migrating and moving to perhaps more mission critical, where the dependency of having the information in real time for somebody who's experiencing a medical emergency might be something that an IoT device can understand, refer to healthcare people, emergency care people, etc. The other thing which is very interesting is that people are becoming unhealthier, whether that's an impact due to the environment or the fact that we're perhaps not eating as well as we ought to be doing, etc. That is a trend that is very, very significant, particularly in more developed countries. And of course, the available treatment is becoming beyond the reach of more and more people, particularly as the population growth exceeds our ability to deliver good health care. And finally, one of the more important ones, particularly in countries like the U.S. and around the globe as well, is that medical costs continue to grow steadily. The phenomenon there of being unable to provide general health care because the cost of medical care is becoming so expensive is something that perhaps a IoT solution can assist with. And this is an area where mobile health devices are becoming more and more prevalent to monitor and perhaps prevent problems rather than try to approach it from a curative basis after the fact. There are a number of major markets that we consider as our subsegments, if you will, of the healthcare industry. First is the assisted living, things like personal emergency response services, people tracking, and medication management, which is what we will dive into a little bit more detail when Lloyd gets to his section of the presentation here. There's clinical remote monitoring, where people who are suffering from particular diseases such as cardiac treatment, diabetes, sleep apnea. There are people who are doing clinical trials for some of these newer diseases that are being monitored, etc. And then there's the word well, what I call the word well segment, which is really people wearing fitness devices, wearables. They may be wearing a connected medical device to report medical data. And of course, there's a lot of smartphone apps out there that are trying to assist people with monitoring their health in general themselves rather than relying on a healthcare provider of some sort. And finally, the approach being taken by a number of people to provide supply chain management for pharmaceuticals and the home health services, setting up places where people, older aging patients or aging elderly people can go to without having to be worried about from a healthcare perspective from their loved ones or from a healthcare provider. That, by the way, that last one over there is actually kind of interesting because we have some interesting what we call social sector products in that area where the people who are looking at how to deliver good quality medication around the world that may have some environmental problems that to deal with, such as being maintained at a particular temperature, etc. So we'll get back to the medication management area in a moment when Lloyd gets to his presentation, but let me continue on some of the impact that telehealth and mobile health devices are having. I'm not going to go through every single one of these, and I think that it's important for you all to be aware that there is success happening. There are studies being done that show that telehealth and mobile health devices, where people are taking the responsibility for their own healthcare in certain ways and are being provided the tools to be able to do that more effectively, are having a good impact. For example, the PwC study that showed that people that use mHealth services, about 50% say that the services effectively replaced some visits because people were able to determine for themselves that perhaps, yeah, I'm okay. I don't need to go see a doctor or a nurse in this particular scenario. Qualcomm did a study in the United Kingdom, or reported on a study in the United Kingdom, that found that there was a 14% decrease in elective admissions to hospitals, 20% decrease in emergency admissions, and basically a 45% decrease in mortality rates because of using some of these newer products that are out there in the IoT space for telehealth, mobile health services and capabilities. And more studies that have shown that there is a significant financial impact that can be achieved by deploying these devices. Deloitte did a study that back about a number of years ago, but they said that by 2021, they estimated that there would be productivity gains estimated at about $305 billion, which is quite significant. They expected these savings to occur via reduced travel time because people were able to analyze their own information, faster decision making, and improved communications, being able to provide the data to the healthcare people in a more predictable, quicker way. GSMA and PwC estimated that last year, mobile health saved almost 100 million euros in healthcare costs in the EU and added 93 billion euros to the GDP. The idea was to reduce the chronic care, the care costs for chronic conditions, and improve the treatment compliance, which is an area that we'll get into in a moment, and basically provide more remote patient monitoring. In general, across the board, you can see that there is an effective outcome when you use a mobile health or a telehealth device in the healthcare industry. Now, in the mobile technology trends, particularly for telehealth, this is where we are fairly active in our services to our customers. You're starting to see an increased cellular use, cellular product technology transport use for these kinds of applications. Why? Because it is a natural transport for a wide area long-range service. Cellular industry has done a darn good job of trying to reach just about every corner of the globe they possibly can where they could have people who are using cellular services. Including in regions where you wouldn't really expect, rural villages out in the middle of nowhere. So you will sometimes find a good cellular service. Not always, but you'll generally find a good cellular service. And it provides simple monitoring. The idea is that you want to be able to send that data without having to rely on other transports that may or may not be available in a particular patient's home, whereas cellular is generally available everywhere. And so we can rely on that as a way of transporting this data. There is a need to expand the amount of information that is available to the clinics, the doctors, and the caregivers in real time. That's starting to happen. I will not tell you today that that's commonplace, but it's certainly something that's starting to happen, particularly in some of the more mission-critical healthcare scenarios. More common is the ability to record and send the transmission based on measurements that were taken in a non-critical environment. For example, sleep apnea. Did the person sleep well in the previous night? Report on that in the morning. Things like that. Reporting blood pressure, reporting blood glucose levels, all those kinds of information. Clearly, this is an area where patient privacy and data access regulation concerns creep in, and we work very carefully from a security perspective on what we can do in that area, and appropriate permissions have to be provided to the people who are gathering the information and from the patients themselves to provide them to their healthcare people, their care providers. There is an evolution occurring in product. There is the need for hybrid transports with short-range and long-range products. For example, when you have cellular on board, sometimes having a backup for lower cost reasons, perhaps having a backup Wi-Fi connection also makes sense. Although we have discovered that from an ease of installation, ease of use, cellular seems to be a better approach because Wi-Fi tends to require configuration on the part of the home person who's using the product or perhaps might require changes down the road where cellular seems to work more effectively. The point is that we're developing this concept of a continual connection between the patients and the care teams that are responsible for looking after those patients. I want to go right into another poll, and I think Joe, I'm going to go ahead and read these questions out for the people, and then wait a few minutes, and then go directly into, if you don't mind. The question for this poll is, what kind of sounds good. What kind of communications do you use for monitoring today? If you have a product that's out there, or you're using a product, or you're aware of a healthcare product, is it using cellular? Is it using Wi-Fi? Is it using satellite for some reason, or is there another technology, perhaps a landline technology that is in use, perhaps an Ethernet jack? We'd love to hear from people about if you're using an IoT service or an IoT product of some kind, particularly in the healthcare industry. What kind of communications do you use? Give people a chance to respond to that question, and then give them about 10 or 20 seconds, and then we'll go on and see what kind of results we have on that one. Okay, let's move on to the poll results and see what people have submitted. Looks like cellular is about 65%, which is not surprising, because of the ease of use. Wi-Fi, available in certain areas, ranges as the next number at 22%. Obviously, I think in the healthcare industry, satellite's unlikely, and so that came out as 0. And other, probably a landline connection of some sort, or a dial-up connection of some sort, depending on the product that's out there. Lloyd, do you have any comments on that?
No, I think that's what I would have expected. There's obviously a number of different communication methods out there, but cellular has got some strong advantages, and I would expect to see them right at the top. Satellite, very expensive option. And certainly not on the medication management side. I wouldn't expect to see them there.
Okay, very good. Thank you. I'm going to go on to the next slide, which I sort of anticipated perhaps a little bit that we would see some good response in the cellular area. Wanted to give people an idea of why we believe cellular has some significant advantages, although clearly there are other transport technologies available. First and most important, that it is a wide area Internet Protocol data service, ability to send data in small to medium to large amounts of data using what I call utility scale systems. What I mean by that is that anything that needs to send kilobytes to megabytes to perhaps even hundreds of megabytes in a wireless environment, cellular is a very cost-effective way of doing so. It has a very low latency, very high throughput for these kinds of networks, although there are some new technologies coming into play that are cellular-based that allow for slightly higher latency and not as good throughput for scenarios where you don't need to send a lot of data. If you're sending between a few kilobytes to a few tens of kilobytes of data every so often, perhaps once a day or more often, slightly more often than that, then there are some newer technologies on the horizon that will allow you to send data in a more cost-effective manner. The one other thing that I think is very important for cellular, and I think that people who deploy applications who have had experience, is that you can essentially have a single business and technical support scenario, which is that you get the data from the source device to the server, and you only have one contract to deal with for companies who are providing these kinds of IoT services. You're not worrying about the fact that a home might not have an ISP service. You're not worrying about the fact that somebody might not have a Wi-Fi router in the house. You're not worrying about something else. Basically, the product has a cellular radio in it, and you have one contract from technical and business support perspectives to be able to deal with all of that. And the final point, which I think I can't emphasize enough, is that many people come to us with product that you think would be easily amenable to other technologies such as Wi-Fi in the house, but we find that the cellular solution gives them completely simplified installation approaches. You don't have to worry about figuring out whose home Wi-Fi router and what password and username you might need to use, etc. Essentially, you take the product out of the box, plug it in, and in general, it works as advertised, literally like that, right out of the box. And you don't have to worry about complex setup issues. And the other sub-bullet point, which is important, is that you can test the device. You can literally transmit over the air on a cellular system at your point of manufacture and determine that everything is working normally before you worry about sending it out in the field and whether it works with a particular user's home Wi-Fi environment or something like that. So in general, these are the kinds of things that our customers tell us cellular has a generic advantage for IoT solutions and also works very well for healthcare devices. Now, what should you expect when you're going out there to look for these kinds of services from a service provider, not just Aeris, but perhaps some of the other people who are out there? These are the things that we recommend you look at. You ask them the questions that make sense here. Do they have IoT experience? Is their business focused IoT, or are they just providing a generic cellular service for a smartphone for a user? What's their coverage? What's their reliability? Do they have redundancy for the systems? What's the security on their network? Are they protecting your data that you're transmitting, in particular because it might have some privacy concerns such as healthcare products? Do you get real-time visibility? Do you get to control your devices that are out in the field? Do you have a variety of different cellular technologies, because in some markets GSM may be predominant, in other markets CDMA and LTE might provide you better coverage or better support? Do you have flexibility in the business model? Can you get rate plans that match your requirements as opposed to worrying about trying to fit a product that is sending a few tens of kilobytes of data to a smartphone kind of user rate plan where you might have gigabytes of data available? Do you match the costs and services associated with that business model requirements? Can you get real-time troubleshooting? Can you automatically move your devices from one rate plan to another? Can you adjust the rate plan based on usage rather than worrying about trying to fit the best way, have it fit yourself the best way to do it? And do you have support staff who understand the concepts of IoT? Do they have your product in mind when they provide you the service support that you would need from your application? So these are the kinds of things that we recommend. You ask your service provider the questions that you're trying to get answered for your IoT applications, and clearly you should ask them of us when you come talk to us, and we'll answer these questions for you. So what I'd like to do is sort of give you some final thoughts before we move on to Lloyd's presentation. One is, and this is a very important point I will mention, is that the telehealth, the mobile health services markets, products and services for those markets are growing dramatically. I am continuously surprised by how many new products I see in different areas that are providing these kinds of these services, including to a degree what I will call mission critical, where the people's lives may depend on the product working well, the service working well, etc. That is a change. That acceptance has taken some time to happen, but we're getting there. The other point to be mentioned is that standard medical care services are not keeping up with the population growth. Simply, healthcare everywhere is an issue. People are aging. You're starting to see more problems, and the health services are not keeping up. So that is a clear area where a technology-based solution that can provide early warning, prevention rather than cure, perhaps in certain cases, monitoring for patients, etc., is a big deal. The communication between the patient and their care teams are increasing continuously. The involvement is increasing. The monitoring of a patient by their healthcare team is increasing. And the healthcare team may not necessarily be a professional doctor. It could also be a loved one who needs to look after a parent or a sibling or somebody who needs monitoring. And finally, very important point, real-time monitoring needs for these kinds of healthcare applications are becoming more and more important. What used to be stored forward, what used to be record, I can remember some number of years ago being given a medical monitoring device where basically I had to wear this thing for 2 weeks and then bring it back in and somebody would take a look at the data. Well, that data, if it could have been sent real time to my healthcare provider, and real time is relative, if it had been sent even every hour or two or every day, would have been a dramatic improvement over what just took place not too long ago, literally 5 or 10 years ago, where you had to wear something for a couple of weeks. So that's sort of my summary of where we are with the medical industry in general. Now we're going to get into the medication management application, the use case that I mentioned early in the beginning. And Lloyd's company, Wisepill, is at the forefront of this. So let me dive in and hand the baton to you, Lloyd, and please proceed.
Great, thanks, Syed. Thanks very much. Well, Wisepill got into medication management back in 2006. It seems like really a very long time ago. And I remember we were approached by a local doctor in Cape Town and he had this great idea of monitoring medication in real time. Something I hadn't been exposed to at all. The idea was something really brand new, and it took a little while for him to explain to me just the ramifications of not taking medication and how that was affecting a country like South Africa, especially with the TB epidemic and the scourge of HIV in the country. It didn't take him long to convince me that this was an area that needed some solutions, and so I'm pleased to say that we were the pioneers in bringing this technology to market, and I think this was an idea almost ahead of its time. As we know, the Internet of Things now is just exploding. And so I think the time has definitely arrived for this kind of technology with all the benefits that it will bring going forward. So I think just to sort of kick off, what I'd like to do is start off with a poll and just to get a kind of an idea what kind of exposure our audience has had to medication monitoring or real-time monitoring. So I think that slide is up there. If you could just choose one of those three options, and we can just have a little look. I'll give you a minute just to register your answers there, and share those results with you. So WisePill, as you know, is a South African company. We're based here in Cape Town, beautiful Cape Town, suffering from a little bit of a drought at the moment, but we're managing to cope with it. Okay, so I'm going to pop across to the result there. And let's have a look. Yeah, so I'm actually pleasantly surprised. That's a fair number, almost 30% of our audience has taken part in or used medication adherence up to date. So that's great to see that. And then we have almost 11% are intending to do that. So that's really good news. All right, so moving along. Yeah, I think it's long been known that the cost of not taking medication is very high. In fact, the numbers are staggering. Just looking at some of the research that's been done recently, there was a review in the Annals of Internal Medicine, and we see that about 20 to 30% of medication prescriptions are not even filled. That's a huge amount. And then 50% of medications for chronic disease are not taken as prescribed. I heard someone say that our toilets today are the most healthy objects that you can find, just because of the sheer amount of medication that's been flushed away. So very concerning and very, very costly. And the lack of adherence is estimated to cause approximately 125,000 deaths and at least 10% of the hospitalizations. And the cost to American health care, more than $100 billion a year. So I don't think this takes a lot of convincing to realize that this is a serious problem that needs to be addressed. Now, the reason why WisePill really got into medication adherence and real-time medication adherence was because of the situation that we had in South Africa. And you're probably aware that we have a very large population that does suffer with TB. We have an estimated incidence of almost 500,000 cases per year. So that's quite a serious problem, and a lot of those individuals are also co-infected with HIV. So in 2007, WisePool Technologies was founded, and with the aim to assist with disease management as a major objective, and then secondly to bring solutions in general to assist in medication adherence management. In 2009, WisePool appointed Everland BV in the Netherlands as our European distributor, and they've worked over the years in a number of areas, concentrating more on the chronic conditions such as diabetes, hypertension, epilepsy, and just of recent times they've been working in the area of cancer with some very specialized drugs that require very strict adherence. 2011, we were very pleased to be recognized by the South African government and the Department of Trade and Industries for the innovation that we had brought to bear on this problem, receiving the Technology Award for Small Businesses. In 2015, again, Everland, working with AstraZeneca, were able to bring solutions for a number of very important cancer drugs. This is a very interesting area, as what we're seeing is that in the future, these pharmaceutical manufacturers and suppliers are really going to be rewarded based on their outcomes and not just for the medication that they deliver. And so they are very keen to actually measure those outcomes and make sure that they understand exactly what is happening, how to segment the various groups that are taking the medication, and to understand the behavior. So in future, pharmaceutical companies will be paid according to health outcomes and not just according to the medication delivered. Very, very important area, and a lot of the pharmaceutical companies are looking very seriously at this area. 2016, we were very honored to be given support by the Bill and Melinda Gates Foundation to provide a tailor-made solution for the management of TB. And we've gone on to two very, very successful implementations, one in China of over 5,000 TB sufferers, and we are currently in India deploying thousands of devices into that country. So very pleased to be associated with that foundation. So to give you an idea where WisePool is currently active, see the little green pins. So we have our offices in Cape Town, where we're able to significantly impact and work closely with partners in South Africa and in the region. And then we have Everland in Europe doing fantastic work on the chronic medication side. And then we've worked both in the United States and South America, also predominantly on HIV research, amongst other things. In India, it's been more in TB work, and then places like Thailand, clinical trials for ARV medication and pre-exposure prophylaxis, which I'll speak to in a moment. So we've been able to deploy our solution in quite a number of different countries. Moving to the next slide. So what are the main areas where WisePool sees opportunities? So we really find four major categories here. The first one being research. WisePool has just recently been involved in a meta-study that measured early treatment adherence in antiretroviral therapy, just as an example. So those results are being tabulated. This was the most comprehensive study to have been undertaken to understand ART by stage of HIV infection. And they had 11 sites, 7 of them in Uganda, Mbarara, and 4 of them in Cape Town. And so very, very interesting outcomes there, and worthwhile looking at some of the early results that they've published. We were also very pleased that the researchers, one of their conclusions was that the WisePool devices were a gold standard in medication adherence measurement. And so we were very pleased to work with them. The second area we have is the clinical trials area. So just really quickly to touch on that, WisePool was selected to run the Truvada trial. So that what that is it's a pre-exposure prophylaxis drug which is used for patients or for people with high risk exposure, so the HIV negative but high risk exposure to HIV. So very successful clinical trials that were run through dozens of universities in the United States, in South Africa and in Thailand. Third area, as an example, disease management. And this is really now moving to what we call implementation. So it's the management of ARVs over the lifetime of a patient. And then as far as TB is concerned, the great thing about adherence in the TB world is that TB is curable. So if we can just get those guys to take their medication for the 6-7 months, they can be TB free. So we're really passionate about that area. We've seen in trials and projects in the past that medication adherence can get to as high as 90-95% with the help of reminders. And then the last area, chronic conditions, and this is really where Evelyn has done a lot of work, our partners in Europe, and this is often medical insurance companies become involved here, but this is a solution that is available to anyone who has a chronic condition. All right, moving to the next slide. Just wanted to give you a little explanation of how the WisePool system works. So you'll see the picture up on your screen over there. That is one of the WisePool dispensers displayed, portable version. So generally what happens is you take your medication, and the devices are very, very straightforward. The complexity is hidden from the user. So all that is required is to take a medication on time, and that's recorded. It goes over the cell phone network. It's recorded on the WisePool web server. The web server actually stores the prescription so that it knows which patient has taken their medicine, and it can respond appropriately. If a reminder is required, it will send out a reminder. And then, of course, we have a browser available to caregivers and managers that might be interested in following a number of different patients. So the really interesting thing about our system, it's not what I call a nag till you remember system. Okay, so you're familiar with the alarm clock that you never hear because it goes off at the same time every day, or the train that might come past your house. Eventually your brain tends to filter that out, so you don't hear it anymore. So we found that just sending a reminder at the same time every day is not as effective as we would want it to be. So what the WisePill system does is it only reminds you if you forget. So it's a remind if you forget solution and not a nag me to remember one. So again, the person using the device, if they take the medication on time, they do not hear from the system. So they only get a reminder if they actually, if they need one. So this is great for the patient. It's great for people that are supporting the patients. It can be used by nurses in home care. It can be used by doctors, and it can be used by companies and organizations that require knowledge on medication behavior and understand some of the segments involved. All right, just moving on then quickly to the sort of application features that we have. So first of all, the WisePill system doesn't require any kind of application to be loaded. It can be used just through a normal web browser. We use dot graphs, which are the standard way, and I'll show you an example of one of those just now. So it's a graphical representation of medication intakes. We provide scoring. It's nice to be able to just at a glance know how well you're doing, to be able to compare your scores with someone else. And the reporting we provide is graphical. It's often for research purposes and management. A tabular version is required. We provide automatic reports as well, so that you can get exceptional data. So the great thing about a system like this is that it enables you to do management by exception. And this is what we found is incredibly useful for disease management. You don't need to manage the 95% of people that are taking their medication every single day. It's the 5% of the exceptions that pop out that one can then concentrate on. So automatic emails and reports that get sent, the ability to export data to another format for further analysis and so on. Interventions can be set up, and this is very flexible. One wants to be able to send a notification under certain circumstances, and one needs to be able to configure that and to customize the messages that are actually sent. We also make sure that the devices are monitored and managed, and they provide technical heartbeats through to the system, so that we can differentiate very clearly between a lapse in medication or perhaps a device that has not been charged and a battery has gone flat. Again, just looking at the kind of graphical interface that you might want to be able to see. So this is just one example where we provide both a level of battery in the red dots there, and this is a particularly adherent person. So you can see they're literally sitting with a stopwatch waiting for their medication time to happen. Right, the devices themselves, some of the typical device features, and so we have from the very portable versions to the larger versions to cater for a lot more medication or alternative types of medication. So we have 2G and 3G cellular solutions right now. We will be expanding to LTE and other versions during the course of this year. Real-time or delayed reporting, so we have both options available. The device itself is able to store many events and heartbeats on board. So any situation where one might leave an area with coverage, the device can store those medication events and send them through at a later stage. We do provide an indication of GPS position. This is normally just an area and not a pinpoint location. And we do this because it's often very valuable to know that in terms of disease management and research, to have a general idea of where the participants are. Battery life, anything from 3 to 12 months. Because we do a lot of work in low resource settings and have collaborated a lot with researchers in Africa, we've adapted the products so that they work very well in those areas. So that means long life in terms of battery usage, and very forgiving in terms of how the networks work and their reliability. Onboard reminders and offboard reminders, also depending on the product that's selected, and then a number of different ways that the battery and signal strength can be monitored. Right, and then nearing the end of our webinar today, I just really wanted to raise a few reasons why our partnership with Aeris has been such a great one, and has such potential going forward. So when trying to get this kind of solution out internationally to many different countries, to very different applications, it's really important that one can provide a standardized solution. And so there's a few areas that this is particularly important. The first one is on device qualification. So when we are literally building and dispensing thousands of devices from the factory, we want to be able to make sure that the devices are working, that they're logging onto the networks, and they are communicating and are in full working order before they leave the factory. So it's really useful. The Aeris SIM cards have a test period where they are tested, and then once they go out, they're reactivated for full usage. Very important. Secondly, just the logistics of sending SIM cards out to different countries. One wants to have it in the unit when it goes out, and not be sending SIM cards all over the world. So from a logistics point of view, this is a really key part of our solution. SIM management, very important, especially since we often have reuse of devices, and this means devices are activated, suspended, deactivated, and brought back on again. And we're able to do that with excellent tools that are available, and that allows us also to place certain limits as well on the SIM cards and protect them and make sure that the SIM cards are used appropriately in the devices, and that is taken care of. And all of these are just important factors in terms of getting an out-of-the-box solution. So we pre-configure the devices in most cases. so that when a device is received by the end user, they literally can start using the device and start checking their adherence. Okay, I think that is about it as far as my slide deck is concerned.
Thank you, Lloyd. Z here. Just a couple of links that we will have available if people want to take a note of that. It's basically gets them information about who we are, what we do, and how we manage the devices on our network. And I think we can move along. Joe, back to you to the questions. Maybe we can go to the final slide where we have some contact information, and we can proceed from there.
All right, very good, Lloyd. Z, thank you. We will move on to the Q&A. Just a reminder to the audience, there's still time to submit some questions using the Q&A button at the bottom of your screen. We already have a lot of great questions, and we will try to get to as many as possible. Our first question up, does WisePill include APIs or other developer tools that would allow other app developers to pull in data from it?
Yeah, okay, that's a great question, and the answer is yes, we do. So we do have a number of APIs that are available, and so we'd be happy for you to contact us, and we can discuss which solutions might be appropriate for your application.
All right, Lloyd, this question's for you. It's a bit long, so bear with me. Opening the container does not mean the patient takes the pill. Does the system monitor the pill was actually taken? Does the system actually monitor that the pill was actually taken out of the container? And then the follow-up is, unless coupled with measuring the drug plasma level, we cannot know the pill was actually taken. WisePill for, well, why don't you go ahead and answer that first part of that question, Lloyd?
Sure. Yeah, also another great question, and a question that comes up very, very often from audiences. And first of all, we don't measure whether the pill has actually been taken and whether it's been swallowed. But we've done quite a lot of research and have quite a lot of experience, and in terms of analyzing the data. And what we have found is that by studying the actual dot graphs and looking at the dot graphs as they present, it's very easy to distinguish between two types of people that take their medication. So the first type of person that's adherent to medication and responds to the reminders. It's quite clear from the patterns that you see on the dot graph. And then you get the second category, and that's the person that's very distracted, that's forgetful, that lapses and forgets to take the medication for days, a few days at a time. And so that is, and I'm talking about medication management here, that's a sure sign that an additional intervention needs to take place. And then you get the other very small category, and that's and you get this in TB management as well, because you probably know that DOTS has been the preferred way of measuring adherence in the past. It's directly observed therapy. So you have a third party that checks to see and makes sure the person takes their medication. But even then, people put the medication in their mouth and they might spit it out later. But what we found characterizing these dot graphs is that those people tend to be undisciplined, the ones that are trying to, let's say, beat the system, and they definitely do not manage to do that every single time. So you see the same lapses happening as you would on someone that's just generally non-adherent. So in response to that, you manage, and again, it's management by exception. So the undisciplined person, that will stick out very clearly, non-adherent person. It's very clear, and so I hope that answers your question.
Are you providing adherence solutions with HIV meds for the Gates Foundation?
So the Gates Foundation, through a company called Arcady, approached us 2 years ago, and they were looking for a tailor-made TB solution. So we have gone ahead with that, and that is what's been used at the moment. The solution works exactly the same for ARTs, and we are now starting the first, let's say, pilots in terms of HIV meds. So this is with the Gates Foundation support and in line with their desire to see the eradication of TB first of all, but also to impact on HIV.
How long will GSM service be available?
Okay, well, let me tackle that one there, Joe. That's a darn good question, and the answer unfortunately varies depending on where you are around the world. If you look at some of the more technologically 4G type of deployed cellular countries where LTE is becoming more rapidly available or has become more rapidly available, then 2G is definitely on the way, and if it hasn't already been shut down. For example, in the United States, 2G was shut down by AT&T, and therefore we don't offer that capability on AT&T at all. So we offer 3G services and LTE services in the United States. And there are countries around the world where 2G is no longer available as well. And in the next 3 to 5 years, you will start seeing degradation of service, perhaps even in some of the more advanced countries that are deploying, skipping over 3G and going straight to LTE. As a result, and as I think Lloyd mentioned this as well, just about every one of our customers who has 2G, 3G products deployed globally is working on LTE products as a result, which is going to be available for at least another 10, 15, 20 years or so.
All right, Z, that pretty much answered the next question. So I'll skip on, but a reminder, this is we have enough time for one more question. And we had a lot of great questions today, and can't get to them all, but we will be getting back to everyone who submitted after the webinar. So for our final question, can you fit insulin pens in the dispenser?
Absolutely. So we have a standard sort of lunchbox sized device called the EveryMed. And I'm pretty sure we'll have to just, we can certainly let you have the measurements for that one. But we've also made a number of customized solutions using hardboard and other less durable materials. And going forward, we'll certainly be open to different size containers going forward.
Great. Z, Lloyd, thank you. I'd like to thank everyone for attending this Fierce Markets webinar and submitting so many great questions. As you can see on your screen, there's some additional Aeris resources. Again, I'd like to thank our speakers for participating and Aeris and WisePill Technologies for presenting the webinar. A reminder, the webinar has been recorded, and you will be able to access the recording within 24 hours using the same audience link that was sent to you earlier. Thank you again for joining, and we look forward to seeing you at future events.
Thank you, Joe. Thank you, Lloyd.